Why are diagnostic criteria important for genetic symptoms? Imagine trying to solve a puzzle with missing pieces or pieces that look similar but fit in different spots. That's what diagnosing genetic symptoms can feel like without clear guidelines. Diagnostic criteria are the set of rules that help doctors piece together the clues from symptoms, family history, and test results. They act like a map, guiding healthcare professionals to the right diagnosis. This is especially important when symptoms overlap across different hereditary health conditions. For example, some genetic disorders share common signs like muscle weakness or developmental delays, but the underlying causes are different. Using specific criteria helps doctors tell these apart accurately. In family genetic testing, these criteria are like a checklist. They help decide which tests to run and how to interpret the results. If someone shows certain symptoms and has a family history of a hereditary condition, the criteria can point to specific genetic mutations. For example, if a person has breast cancer at a young age and a family history, testing for mutations in genes like BRCA1 or BRCA2 becomes a priority. This targeted approach saves time and resources and increases the chances of catching the right condition early. Early detection is a game changer. When doctors use clear diagnostic criteria, they can identify genetic disorders before symptoms worsen. This allows for early interventions, such as lifestyle changes, medications, or surveillance programs that can prevent or lessen the severity of health problems. For hereditary conditions like neurofibromatosis or Marfan syndrome, early diagnosis can mean better management and improved quality of life. Another key role of diagnostic criteria is helping families understand their risks. Many genetic conditions run in families, so if one person is diagnosed, relatives can be tested too. This helps identify who might be at risk and guides decisions about preventive care or genetic counseling. It also creates consistency in how different healthcare providers approach diagnosis and treatment. As science advances, these criteria are updated to include new genetic discoveries. For example, recent changes in criteria for conditions like neurofibromatosis now focus on specific gene mutations, making diagnoses more precise. This ongoing process helps personalize medicine, ensuring each patient gets the most accurate diagnosis possible. In short, diagnostic criteria are the foundation for understanding hereditary health and disorders. They help doctors make accurate diagnoses, guide testing, enable early intervention, and support families in managing their health. Knowing how these criteria work can make a big difference in understanding why certain tests are recommended and how a diagnosis is made.